Every single morning, your body goes through a transition that places more demand on your heart than almost any other time of day. And for millions of people, that transition is quietly revealing warning signs that something is wrong, signs that are being dismissed, explained away, or simply never connected to heart health because nobody ever explained what to look for. What we are going to talk about today are 4 specific things that can happen in the morning, in the first minutes and hours after you wake up, that an emergency medicine doctor would take very seriously if a patient described them. These are not dramatic chest-clutching symptoms from a movie. They are subtle, easy to rationalize, and often completely overlooked for months or even years before something more serious happens. Stay with us until the end of this video, because the 4th sign is the one that sends the most people to the emergency room completely unprepared, and it is also the one that is most commonly brushed off as nothing. Before we get into the 4 signs, it is worth spending a moment on why the morning is such a critical window for cardiovascular health. When you sleep, your heart rate slows, your blood pressure drops, and your cardiovascular system operates in a lower demand state for several hours. But in the hours just before and after waking, a series of biological changes happen rapidly. Stress hormones including cortisol and adrenaline surge. Blood pressure rises, often sharply. The blood itself becomes more viscous and more prone to clotting in the early morning hours. And the heart is asked to shift from its overnight resting state to its daytime working state in a compressed period of time. For a healthy heart with healthy arteries, this transition happens smoothly and without issue. But for a heart that is already under stress, dealing with partially blocked arteries, elevated pressures, or a weakened muscle, this morning demand can reveal vulnerabilities that remain hidden during the quieter hours of the day. This is why emergency physicians see a consistent pattern of cardiac events clustering in the early morning hours, and it is why the symptoms that appear during this window deserve more attention than they typically receive. The first morning sign is unusual fatigue that is present from the moment you wake up, before you have done anything to justify being tired. Most people experience some degree of morning grogginess, and that is entirely normal. What we are describing here is something different and more specific. It is waking up after a full night of sleep feeling as though you barely rested, feeling heavy, depleted, and lacking the energy you would expect to feel after hours in bed. This kind of persistent, unexplained morning fatigue, particularly when it is a change from how you normally feel and when it continues for days or weeks, can be a signal that the heart is working harder than it should just to maintain basic function during rest. When the heart muscle is weakened or when coronary arteries are partially blocked, the heart has to work harder to deliver adequate blood and oxygen throughout the body, and this increased workload can manifest as a feeling of profound tiredness that sleep does not resolve. Doctors in emergency medicine often hear patients describe this symptom as background noise that they adjusted to over weeks before something more acute brought them in. And looking back, they recognize that the persistent morning fatigue was part of the picture all along. The second morning sign is shortness of breath that is disproportionate to your activity level, particularly shortness of breath that occurs when you are doing very little or even lying down. For many people, the first time they notice this symptom is in the morning, when they sit up in bed or when they walk to the bathroom and find themselves more breathless than that minimal amount of movement should explain. The connection to heart health comes from the fact that when the heart is struggling to pump effectively, fluid can back up into the lungs, a condition called pulmonary edema in its more severe form, but which causes shortness of breath at lower levels of exertion long before it reaches that stage. Some people also notice that they wake up in the night or early morning feeling suddenly breathless, a symptom called paroxysmal nocturnal dyspnea that is considered a significant indicator of cardiac stress. Others find that they need to prop themselves up with more pillows than usual in order to breathe comfortably while sleeping, because lying flat causes fluid to redistribute in ways that increase pressure on the lungs. Any of these breathing changes, particularly when they represent a change from your usual baseline, deserve a conversation with a doctor rather than an assumption that you are simply out of shape or dealing with seasonal allergies. The third morning sign is swelling in the legs, ankles, or feet that is most noticeable first thing in the morning or that is present when you get out of bed before you have been on your feet at all. Most people understand that legs and ankles can swell after a long day of standing or sitting, and that this kind of end-of-day swelling is often benign. But swelling that is present first thing in the morning, before gravity and activity have had a chance to cause it, is a different situation entirely. This kind of morning swelling, particularly if it is new, progressive, or accompanied by any of the other signs we are discussing, can indicate that the heart is not pumping efficiently enough to circulate fluid properly throughout the body. When cardiac output drops, fluid accumulates in the tissues, and because gravity pulls it downward, the legs, ankles, and feet are often where this fluid collects first. Pressing a finger into a swollen area and observing whether the indentation remains for several seconds, a phenomenon called pitting edema, is something emergency physicians look for specifically as a sign of fluid retention connected to cardiac or other systemic issues. If you are waking up with unexplained swelling in your lower extremities that wasn't there before, this symptom warrants medical evaluation rather than an assumption that you simply need to put your feet up. The fourth morning sign, and the one that sends the most people to the emergency room without any prior warning, is chest discomfort, pressure, tightness, or heaviness that occurs in the morning and may or may not be accompanied by pain in the jaw, left arm, shoulder, back, or upper abdomen. The reason this sign is so often missed or explained away is that the presentation of cardiac symptoms is remarkably diverse and frequently does not match the dramatic, unmistakable chest-clutching portrayal that most people expect. Many people experiencing genuine cardiac stress describe what feels like indigestion, a heavy weight on the chest, a feeling of pressure or squeezing rather than sharp pain, or a vague discomfort that is difficult to characterize precisely. Women in particular are more likely to experience cardiac symptoms that are atypical and easily attributed to other causes, including nausea, jaw pain, unusual fatigue, and back pain without the classic chest symptoms that are more commonly associated with heart attacks in men. The morning timing is significant because the cardiovascular demands of the waking transition, combined with the increased blood viscosity and hormonal surges of the early morning hours, can push a compromised coronary artery into a situation where blood flow is insufficient to meet the heart muscle's needs, causing the discomfort that represents the heart's signal that something is wrong. Now let's talk about why these four signs are so consistently overlooked, because understanding the psychology of dismissal is just as important as understanding the physiology of the symptoms themselves. The human tendency to normalize and explain away gradually developing symptoms is remarkably powerful. When morning fatigue develops over weeks, it doesn't feel like an alarming change because each individual day doesn't feel dramatically different from the one before. When mild breathlessness develops slowly, people adjust their activity level unconsciously to avoid triggering it, masking the symptom from themselves and from anyone who might notice it. When ankle swelling develops gradually, it becomes part of the background of daily experience rather than a new and concerning finding. And because none of these symptoms feels like what people imagine a cardiac emergency would feel like, the mental leap to this might be my heart rarely happens without prompting. This is one of the most important reasons why education about these early warning signs matters so much. Not because knowing about them guarantees someone will seek help immediately, but because naming them and connecting them to cardiovascular health removes at least one barrier to that mental leap. The morning timing of these symptoms is also worth examining from a practical standpoint, because mornings are when people are most likely to dismiss what they are experiencing. In the morning, people are often rushing, they are preoccupied with the demands of the day ahead, they may attribute how they feel to poor sleep or stress, and they are in a context where seeking medical attention feels disruptive and logistically complicated. Many people who ultimately do seek care for cardiac symptoms describe a period of days or weeks where they noticed something in the morning and then got busy with the day and forgot about it, only to notice it again the next morning. Breaking this cycle of noticing and forgetting requires an understanding of why morning symptoms in particular deserve to be taken seriously rather than deferred until they feel urgent enough to act on. Let's also talk about the population for whom these morning warning signs are most critically important, which extends beyond just older adults, though older adults are certainly in the highest risk group. Anyone with known cardiovascular risk factors, including high blood pressure, high cholesterol, diabetes, a family history of heart disease, smoking history, obesity, or a sedentary lifestyle, should approach morning symptoms with a heightened level of attentiveness. People who have previously been diagnosed with any form of heart disease, including coronary artery disease, heart failure, or arrhythmias, should have discussed with their doctor what symptoms should prompt an emergency response versus an urgent outpatient evaluation, because that threshold differs by individual circumstance. And people who have been told they have borderline or well-controlled risk factors should understand that well-controlled does not mean eliminated, and that morning symptoms deserve communication with a healthcare provider regardless of how well managed their underlying risk factors appear on paper. Something else worth discussing is the difference between symptoms that warrant calling emergency services immediately versus symptoms that warrant an urgent call to a doctor or same-day medical evaluation. Let's also take a moment to talk about something that doesn't get enough attention in conversations about cardiac warning signs, which is the role of sleep quality in revealing underlying heart stress. The quality of overnight sleep is directly connected to cardiovascular health in multiple ways, and some of the morning symptoms we have discussed are actually a continuation of processes that begin during the night rather than starting fresh when the alarm goes off. Sleep apnea, for example, is a condition where breathing repeatedly stops and restarts during sleep, and it places significant stress on the heart through repeated drops in oxygen and repeated surges in blood pressure during each apnea episode. People with undiagnosed or untreated sleep apnea often wake in the morning with headaches, fatigue that sleep doesn't resolve, and a feeling of not having rested, which overlap meaningfully with the cardiac fatigue we discussed as the first morning sign. Sleep apnea is both a cardiovascular risk factor in its own right and a mirror of existing cardiac stress, and it is estimated to affect a very large proportion of people with existing heart disease, the majority of whom have never been formally evaluated for it. If your morning fatigue is accompanied by waking with headaches, if you have been told you snore loudly or stop breathing during sleep, or if your partner has noticed pauses in your breathing, raising the question of sleep apnea with your doctor adds an important dimension to the cardiac picture. Heart rate patterns in the morning are also worth understanding because the heart's behavior immediately after waking can be informative. In a healthy cardiovascular system, heart rate rises gradually and smoothly from its overnight low as the body transitions into wakefulness. An irregular heart rhythm, a heart rate that feels unusually rapid or unusually slow upon waking, or palpitations that occur specifically in the morning and improve as the day progresses can all be signals worth reporting to a doctor. Atrial fibrillation, which is an irregular and often rapid heart rhythm, is the most common cardiac arrhythmia and is significantly associated with stroke risk. Many people with paroxysmal atrial fibrillation, meaning atrial fibrillation that comes and goes, notice it most in the morning hours when the autonomic nervous system is undergoing its daily transition and the conditions that trigger arrhythmia are most likely to be present. Feeling that your heart is skipping beats, fluttering, racing without explanation, or simply feeling irregular in the morning is a symptom that deserves specific documentation because the timing and pattern of palpitations are important clinical information that helps doctors understand whether they are benign or concerning. The relationship between blood pressure and morning symptoms is another layer worth adding to this conversation. Blood pressure follows a natural daily rhythm, typically reaching its lowest point overnight and then rising in the early morning hours before and after waking. In people with hypertension, this morning rise in blood pressure can be particularly sharp and significant, a phenomenon researchers call the morning blood pressure surge. This surge has been associated with increased cardiovascular risk and is one of the mechanisms behind the clustering of cardiac events in the morning hours. Some blood pressure medications are specifically designed with this morning surge in mind, and the timing of when medications are taken can influence how well this surge is controlled. For seniors who monitor their blood pressure at home, Checking it first thing in the morning before taking medications and before getting active gives a meaningful picture of this morning surge, and significantly elevated readings at this time point are worth discussing with a doctor even if readings later in the day look acceptable. In general, chest discomfort, pressure, or pain that is new, severe, or accompanied by shortness of breath, sweating, nausea, or arm and jaw pain should be treated as a potential emergency and should prompt calling for emergency help without delay. The other symptoms we have discussed, morning fatigue, breathlessness with minimal exertion, and new or progressive leg swelling, are less likely to represent an acute emergency in the moment but are important enough to warrant same-day or next-day contact with a healthcare provider rather than a wait-and-see approach over several weeks. The key question to ask yourself is whether what you are experiencing represents a change from your baseline, whether it has been persisting or progressing, and whether it fits any of the patterns we have discussed. If the answer to these questions is yes, getting it evaluated is always the right choice. It is also worth briefly discussing what happens during a cardiac evaluation when these kinds of symptoms are reported, because many people hesitate to seek care partly because they are not sure what to expect and partly because they worry about wasting a doctor's time if it turns out to be nothing serious. When a patient presents with morning cardiac symptoms, the evaluation typically includes a detailed history of when and how the symptoms occur, a physical examination including listening to the heart and lungs and checking for fluid retention, an electrocardiogram to look at the electrical activity of the heart, blood tests to look for markers of cardiac stress or damage, and in some cases imaging studies. None of this is invasive or complicated, and being told that everything looks reassuring after a thorough evaluation is a much better outcome than discovering a serious problem only after it has had additional time to progress. Before we close, it is absolutely essential to say clearly that this video is for general educational awareness only. None of the information here constitutes a medical diagnosis, and none of it should substitute for evaluation by a qualified healthcare provider. If you are currently experiencing any of the symptoms described in this video, particularly chest discomfort of any kind, that is a reason to seek medical attention today, not to continue watching videos. If you are uncertain whether what you are experiencing warrants emergency care or an urgent call to your doctor, erring on the side of caution and making that call is always the right decision. Hearts do not give unlimited warnings before serious events occur, and the morning window we have discussed is one of the most important times to take those warnings seriously. If this video gave you or someone you care about a clearer picture of what to watch for in the mornings, please share it with the people in your life who need to hear this, because this is information that most people only discover after something has already gone wrong. If you found this video helpful, please like it and subscribe to Dr. William Heart Health for more videos like this every day.